Hi, I'm Dr. Sharbell Hashoul, and today let's talk about a question that weighs heavily on many patients, lumpectomy or mastectomy, and how imaging helps guide that decision. If you or someone you love has been diagnosed with breast cancer, one of the first big decisions is what kind of surgery makes sense. A lumpectomy removes just the tumor and a rim of healthy tissue around it, keeping the rest of the breast. A mastectomy removes the entire breast. Neither one is automatically better. It truly depends on the individual situation, and imaging plays a huge role in figuring out which path fits best. So how does imaging actually help with this decision? Think of imaging as a map. Before any surgery is planned, doctors want to know three main things: how big the tumor is, whether there's more than one area of concern, and how the cancer relates to the rest of the breast tissue. Mammograms give an overall picture and can sometimes show calcifications, which are tiny calcium deposits that may spread out over a wider area than a single lump. Ultrasound adds more detail, especially in dense breast tissue, and helps doctors see the exact borders of a mass. Breast MRI, which uses magnetic fields rather than radiation, is often the most sensitive tool for detecting additional areas of concern that might not show up on mammogram or ultrasound alone. It's particularly useful when doctors are trying to determine whether cancer is confined to one area or scattered across different parts of the breast. This matters because lumpectomy works best when the cancer is contained to one area that can be removed with a good margin of healthy tissue around it, leaving the breast looking and functioning reasonably close to normal. If imaging shows multiple separate tumors in different parts of the breast, something called multicentric disease, or if the area of concern is very large relative to the size of the breast, a mastectomy may be recommended instead, because removing enough tissue for clear margins with a lumpectomy might not be possible or might not give a good cosmetic result. Imaging also helps estimate size accurately. Sometimes a lump can be felt on physical exam, but imaging reveals it's larger or smaller than it initially seemed. This size information, combined with the size of the breast itself, helps predict what the breast will look like after a lumpectomy, which is part of the conversation between patient and surgeon. Another piece of the puzzle is checking the lymph nodes under the arm. Ultrasound is often used here too to see if any nodes look enlarged or abnormal, which can influence both the surgical plan and whether additional treatments might be considered. It's also worth mentioning that lumpectomy is typically followed by radiation therapy, while mastectomy sometimes is not, depending on individual factors. This is another piece doctors factor in when discussing options with a patient, not just what imaging shows, but what treatment plan makes sense as a whole. I want to be clear about something important. Imaging informs the decision, but it doesn't make the decision alone. Personal preferences matter enormously here. Some patients feel strongly about breast conservation and keeping as much natural tissue as possible. Others feel more at peace choosing mastectomy, sometimes even when a lumpectomy would have been medically appropriate. Both choices are valid. The surgical team's job, with the help of imaging, is to lay out what's medically possible and safe, and then have an honest conversation about the pros, cons, and what matters most to that particular patient. It's also worth knowing that sometimes imaging findings shift the plan mid-course. For example, if an MRI done before surgery reveals an unexpected second area of concern, the surgical team might reach out to discuss whether the original plan still makes sense, or whether additional biopsies or a different approach might be needed. This isn't a sign that something went wrong. It's simply part of how careful, thorough planning works. Here's the practical takeaway. If you're facing this decision, ask your care team specifically what your imaging shows about tumor size, whether there's more than one area involved, and how that translates into your surgical options. Don't hesitate to ask them to walk you through the images or explain the reasoning in plain terms. Understanding the why behind a recommendation can make the whole process feel less overwhelming. Every breast, every tumor, and every patient is different, so these decisions are always made individually between you and your own medical team based on your specific imaging and pathology results. Thank you for spending this time with me today. Take care of yourself, and I'll see you in the next video.